The importance of mental health with women and how their provider can help is actually a kind of a three-pronged thing. We do know that women are more prone to depression and anxiety. That is not because they experience it more than men. I don't want to discount men's feelings. We just act on things differently. So women internalize things. They quietly cope and they nurture themselves into a lot of problems. So we try to help others with their problems more than we help ourselves. We ruminate on things a little more. When they say women never forget, they really don't. We categorize it, we put it inside, and we save it and put it on the shelf for later. The other thing that we do is we are still, even in this day and age, even though we work full time, most of us, we are still the main caregivers. So we want our families to do well to the expense of ourselves. And we often don't take time to realize that we're going to be better if we take care of ourselves on top of taking care of everybody else. You don't have to give up on someone else to take care of yourself. They go hand in hand. Another thing that's interesting is women are lower on the totem pole still. So women experience poverty more. They are not as financially well as men. They are also victims of sexual abuse and violence, and more than men. Not to say again that men don't experience these things, but women are more prone to that. So that causes PTSD type symptoms with depression and anxiety, and then they internalize, and it reduces their self-worth, it reduces their ability to cope, it reduces their health ultimately. We totally forget that our body responds to our emotions just like our minds do. So if we stay in that state of depression, anxiety, or pain, then eventually the body responds. You have things like ulcers, you have things like heartburn, you have things like abdominal issues, constipation. All of these things, our mothers used to talk about the nervous stomach. It exists, that's what it is. It's related to our emotions. So if we stay too long in those states, then we eventually will develop disease. The way we can handle that, there are multiple things. I always try to start with the first stuff, which is, how do you talk about your feelings? Do you have a good support system? Do you have somebody to talk to about it? Are they a good support system? Just because they're there listening doesn't mean they're helping you, they're raising you up. You should exercise. Exercise releases so many chemicals in the brain. It is just as potent as an antidepressant. And we often, again, I can't take time for that. I don't have time for that. You do have time. You need to take time. It will help lift those emotions. That'll help get you out of it. A healthy diet. I could harp on it 50 million times, but it means so much. The next step would be counseling to me. It has tons of value. The main thing that it does is to help us come up with a good diagnosis. Like, we often don't know why we feel as bad as we are. I have patients many times that'll say, I don't know, I just can't get myself out of this funk. I feel terrible. And I say, well, what's going on? I don't know. And then we go through their history and they mention that they were rape victims, or they mention they were abused as children. And they don't identify that their depression may be coming from a lot of that. They just don't see it as a problem. Well, I had it when I was a child. Yeah, I believe that is still there. We never get away from it all the way. So how did you deal with that? That's our next step. What action did you take to cope with that? And if they do that, counselors are like allotted times for you to work on you. Then at the same time you make your counseling appointment, you need to make an appointment with your provider. So get in with them so that you can explain where you're at and what's going on. Because after you speak with that counselor, they're going to give you a lot of good feedback, and that's going to help your provider if you may need medication. And there's no shame in needing that. Sometimes things are just too overwhelming and we need space between the problem and our lives. So medication can do that. That gives your provider so much better feedback on how to treat you, how to give you the medication that's going to help the best. So if you take all those measures into account, you're going to feel so much better. And you're also going to, again, be empowered in healing yourself. This is your process. It's not just ours. We're here to advocate for you.